Hello, this is Dr. Gay from First Lake MRI. This is a 46-year-old male with complaints of knee pain. They went to the orthopedic surgeon and they had no history of prior trauma, but just bad knee pain. And they drained off some fluid from the knee, but then the fluid came right back. And after that, they decided to do an MRI to see what was going on. And the patient had a couple little round things. This is one up here that's just benign. This is a little benign bone tumor called an enchondroma. It's in the femur, this big bone here. Very, very common. It's a very small lesion with sharply defined margins, no abnormal signal in the surrounding fatty marrow. And these are, again, very, very common of no clinical significance. But there's another thing down here beneath the tibial articular surface. So the femur is up top, tibia is down below. We see the tibial plateau right here. This dark band is the cortex, and the bone is eroded right through. The little bone lesion has eroded through the cortex. If we put up another view that's sensitive to marrow and fluid, we can see here the marrow is infiltrated by a fluid. Marrow should be dark like here. Instead we see this fog of marrow edema around the periphery. So this is a little bone lesion with a halo of marrow edema. Now this patient had no prior trauma, and the question is, well, what is this thing? So this does look like an osteoid osteoma. An osteoid osteoma is a benign tumor. You can have a little central nidus like this. It usually involves the cortex. You see a little round ball just like this. You see a halo of marrow edema around it just like this. So this is what an osteoid osteoma could look like. And this patient has had no prior trauma. But apparently they went to surgery, and in surgery they took out the bone, and the doctor, I just spoke with them to get some path follow-up. He said they were told by the pathologist that it was an infection. So apparently for some reason in the central articular surface they had a small bone infection there, and that's what was causing this. So he was in the hospital for a few days, and I was out and doing well, but an interesting case of a small area of infection, osteomyelitis, with no history of drug abuse or any other risk factors, which is interesting. And this other little benign bone tumor here called an enchondroma of no clinical significance. And that's it. Thank you very much.